In this video, I want to talk about what it means to get a mental health disorder diagnosis. Mental health diagnoses are given based on this manual called DSM-5. DSM-5 labels a cluster of symptoms that co-occur. To use generalized anxiety disorder as an example, there are a number of symptoms that have to occur together within the same individual to be given that diagnosis. But this doesn't mean that the label pinpoints to any specific root cause. And this is clearly known, and it's widely accepted that these labels do not identify any root causes. They simply name a group of symptoms. And this is very helpful when you're suffering from a variety of symptoms and you're unsure what's happening with you. And this was definitely the case for me when it was happening to me. And it was really helpful to get a diagnosis, because then I could name it and I could see it as something that happens to many other people and that there's a pattern to it. And it gives you hope initially towards finding a treatment for it. But then, unfortunately, my experience after getting a diagnosis was very disappointing. When I was at my worst, I went to a psychiatrist. The default option when you go to a psychiatrist is medication, because the psychiatric community operates from this hypothesis or belief that mental health disorders are caused by chemical imbalances in the brain. So the medications are supposed to fix that chemical imbalance. And this solution could be fine if it worked for everyone, or even for most people. Unfortunately, it doesn't work for most people. Definitely didn't work for me. For some people, they take medication, and in the meantime, within a year or two, their symptoms disappear, and then they're able to stop the medication and move forward with their lives. Or some people are okay with taking the medication long term because they don't have to suffer from bad side effects. So it's manageable for them to continue to take it. And I have no issue with that. I think that's great that it works for them. But my current understanding of psychiatric medication is it's very similar to taking a painkiller while your body is fighting an illness. So you're not actually treating or eliminating the root cause or eliminating a disease. You're just managing the symptoms while your body hopefully gets better on its own in the meantime. And this is wonderful when it works. The problem becomes more apparent in cases like mine. So in my case, none of the medications I've tried offered full recovery for me. I never got fully better. I had slight improvements in some of my symptoms, but then the side effects of each medication, and the side effects varied based on the medication. It was different side effects for each medication, really. So I had to continuously change my medication, hoping that the next medication would have more manageable side effects while being helpful. So that wasn't the case. I tried 7 different medications over a decade. The most frustrating thing about having gone through this process is the fact that I was kept on a path that was never going to work for me. Other treatment options as supporting treatments were discussed. One of the options was psychotherapy. But the problem with these other treatment options that are offered is that each treatment option works from within their own paradigm. There is no unifying understanding that's widely accepted that treats mental disorders effectively. So if you go to a therapist that is psychodynamically trained, you focus on your past experiences, you investigate your relationship with your parents. Or if you go to a CBT practitioner, you talk about changing some thought and behavior patterns. It's a completely different approach. They perhaps help in their own way to a certain degree, but it's not as efficiently targeted as it should be, because they're not operating from a unifying theory of mental health and what causes it. So pretty much each therapist or each mental health practitioner, they have a version of their understanding of what causes it and what might help that person, but that's just a little bit arbitrary. So I was in psychodynamic psychotherapy for 3 years. I can say that it definitely didn't help me. After that, I wanted to give it a try again with a CBT approach. I did 8 sessions, but then it started to get very expensive. And again, I didn't see that much of a big difference. So another treatment option that I tried was RTMS, which also initially helped, but then it stopped working after about 6 months or so. When it comes to exercise or nutrition, they're treated merely as an afterthought. It's not an integrated component of a comprehensive plan. It's not specifically discussed as it relates to mental health. So in my search for alternatives, I came across metabolic psychiatry, and metabolic psychiatry looks at the body as a whole, and it recognizes that the brain is not separate from the rest of the body. So this was a turning point for me. Metabolic psychiatry approaches really helped me in a life-changing way. When I began researching how my diet might be impacting my mental health, and when I discovered a ketogenic diet as a potential treatment, I brought it up with my family doctor to get his opinion on it, and he said that most likely my mental health symptoms had nothing to do with the way I eat. So the mental health field needs a paradigm shift. Metabolic therapies such as a ketogenic diet have proven to be highly effective for many people, yet they're not widely recognized or utilized within the conventional system. Medications certainly have their place, but they should be just one part of a broader, more personalized treatment strategy that targets the metabolic health of the brain, which is the root cause. Metabolic therapies like the ketogenic diet have been life-changing for me, and I believe they could be for many others if they were given the attention that they deserve. There are other metabolic therapies that are discussed in Dr. Chris Palmer's book, Brain Energy. Exercise is one of them, but the ketogenic diet intervention was the one that worked the best for me. So these metabolic treatments really have to be tailored to the individual. What has to happen is an integrated approach. Metabolic dysfunction in the brain as a root cause needs to be integrated into standard psychiatric care. Current standard treatments aren't grounded in a clearly understood and accepted root cause, and because of this, people are left with solutions that only partially manage their symptoms. Some people with the resources are able to seek alternatives that work, but many people can't afford it. Other people like myself spend hours researching alternatives such as metabolic therapies. Unfortunately, many people don't have the means or the ability to explore these therapies on their own. I manage my mental health with the ketogenic diet on my own, but I struggle with not having the support of a care team to guide me through it. That's all for this video. Thank you for watching.